Thank you, Chairman Casey, and thank you to all the witnesses coming here today. The Aging Committee, been on it since I've been in the Senate, and really gets to the crux of a lot of issues out there that other committees don't do. We can't technically legislate through it, but we've had more interesting hearings here that are applicable to everyone's lives, even though it's aging. A lot of times it even rolls down to where it impacts younger people. We're all going to be there someday. By 2030, adults will outnumber children for the first time in our country's history. We're experiencing a shortage of long-term care workers and expected to get worse. Proud of the fact that Indiana, a very entrepreneurial state, has been on the leading edge of this issue for a long time. Strata Education Foundation, based in Indianapolis, is transforming education by partnering with educators, policymakers, employers to increase opportunities through work-based learning. We need innovation at the state and local levels to meet this increased demand. We don't need really a lot more from the federal government, in my opinion, simply because it's doing a lot. It's borrowing a lot of it from our future generations to do it. In the laboratory of 50 different states where you got to live within your means, I think might be a better way to approach it. In September, the Biden administration proposed staffing minimums for nursing homes, which would impact all long-term care providers, making a mandate. Well, 80% of them may have trouble getting to that staffing level as a mandate, may be forced to close their doors. I think that'd be counterproductive. Today, we hear many other proposals for cumbersome federal regulations, requirements, and protections. And again, maybe we ought to look to an approach that's going to have more impact, be more effective. Giving more power to the federal government usually means spending more money, almost all of which we borrow. We don't actually have it here to do. These solutions, and sometimes, are very partisan in nature as well. I think that, again, emphasize what has worked and where we can afford it, and where you can be more entrepreneurial may be the best way to go about it. When it comes to protecting healthcare workforce through OSHA, you're pushing for duplicative requirements that have huge costs in many cases. I introduced the Voluntary Protection Program with Senator Bennett, which allows OSHA to work alongside employers and workers to encourage businesses to adopt stringent safety and health standards for their employees. VPP, which it's called, have shown injury and illness rates 50% lower than industry averages where it's been implemented. And that is where you're working in a voluntary basis with the employers that are going to have to make the difference, saving $257 million. To grow the long-term care workforce, the federal government should make it easier for people to enter by removing barriers. Senator Kaine and I introduced the Jobs Act, which allows federal Pell Grants to be used for high-quality, short-term job training, including long-term care. Senators Rosens, Collins, and I introduced the Train More Nurses Act, which passed the Senate in January. This bill reviews all nursing grant programs to find ways to increase nursing pathways. Senator Klobuchar and I introduced the Skills Investment Act and the Freedom to Invest in Tomorrow's Workforce Act, which expand Coverdell and 529 education savings accounts so Americans can use their funds for training and credentialing. These bills address the needs for our workforce and our growing aging population in a bipartisan way without steep costs associated with them. We ought to focus on productive approaches to build and grow the care profession. Look forward to hearing today about state innovations, workforce challenges, and thoughtful solutions to an issue that definitely needs our attention. I yield back.